Hello, AHEC scholars. I am Dr. Susan Wiers. I am an assistant professor in the College of Nursing at Wayne State University. I have met some of you through Zoom and others simply by email, but it's time that I explain what I'm doing here. Dr. Gibson Scipio, who has been your faculty to date, is transitioning out of her role at AHEC so that she can focus on other things in the College of Nursing. I will be taking over and actually have started taking over that role, transitioning into it since the first of the semester. Please bear with me, the learning curve is quite steep, and so if I don't know the answer to something, I'll admit so, and I will find it out for you. My title is the interprofessional education champion, and so that is my role. I have been teaching at the College of Nursing since 2016. I have been a clinician the majority of my professional career as a registered nurse over the last 40 years. And as a clinician, I've primarily been a family nurse practitioner working in a family practice setting for the last 20 years. So I have a really deep understanding of what happens in primary care and issues surrounding provider and patient interactions. Telehealth most recently has been part of my life, and some of the issues in terms of access to care and cost of things and things of that nature. So in addition to that, I have a unique background in that I was a hospice nurse for 5 years at one point in time, and that afforded me the opportunity to work in a true interprofessional collaborative team that is embedded in the hospice requirements by CMS. So for Medicare payments, they have to do certain things, and one of it is to conduct routine interprofessional meetings regarding patients. So whoever, for instance, if a patient's needs were more spiritual in nature, then that meant that Father Robert, our priest, was the person who led the discussion on that particular topic. So it was in the true interdisciplinary, at the time, I think that was the language, it's been a while, a team in that. So I've had some experience, more so than most people do here in this country. We don't do a lot of that. There are some other settings, but that one is huge in terms of it's been done for many, many years, and it is embedded on a weekly basis. At the College of Nursing, I primarily teach in the DNP, Doctor of Nursing Practice program. I have done some community-based clinical sites, which I have a couple this semester. I worked a lot with the family nurse practitioner students in terms of their clinical practicum there. Just introducing myself and my background, I want you to know I am available to meet with you as individuals, as groups, via Teams or Zoom. I have already had one of those meetings so far, and if you have something you want to discuss with me, I don't want you to feel isolated and like you don't have the opportunity to interact with me personally. We'll set something up. And certainly don't hesitate to email me. My email is gf, as in girlfriend, 6140 at wayne.edu, and that's gf6140 at wayne.edu, and I believe that's published in the course somewhere too. So feel free to reach out to me, and I look forward to working with you as you are completing the end of this program and seeing what your practice transformation projects look like. It's an exciting thing to do, and it makes you understand how you take these principles you have learned in this program and apply them in the real world.